Hi, my name is Patricia Ares-Romero, and I'm the Chief Medical Officer of Smart Body MD. We are located in Bay Harbor Islands, just 15 minutes from South Beach, Aventuras, and Miami. We practice functional and metabolic medicine, as well as medical weight loss and anti-aging. We have a model of mind, body, and spirit. We like to treat the entire patient. We look at each patient individually, assess how they are nutritionally, if they're hormonally sound, nutritionally sound, to be able to get a better idea of how to treat the patient. The nice thing about what I do is that I like to treat the causes and not just disease. I believe the fellowship has helped me in being able to look at medicine in a different way. Being trained traditionally, you tend to have blinders, and you tend to see patients as, no, there's impossible, you can only have these symptoms, you know, the book says. Being in the fellowship, it helps me to realize that patients, you really need to listen to their symptoms, and that's what you need to address. The nice thing about my practice is I get to take time with my patients. We get to go over a clinical history, treatment plan, treatment options. We get to address all the patient's questions. So it's very nice. I get to take my time and spend as much time as my patient needs. Balancing your hormones does contribute to help you avoid diseases, obesity, heart disease, osteoporosis in women. So yes, definitely bringing the body back to balance does prevent a lot of illness. At Smart Body, we only replenish what is missing as far as their hormones are concerned. We want to bring them to a healthy level. We never bring them up to levels that are non-physiological. We are all affected by stress. You know, it's always been said that a little level of stress is good. You know, that's what gets us up in the morning, gets us to work, and gets us to actually fulfill our duties and our jobs. But too much stress can be dangerous and harmful to our entire system. It can cause inflammation, it can cause adrenal fatigue, and cause so many illnesses. So what I try to do with my patients is teach them a different way of dealing with stress. We talk about stress modification, we do lifetime coaching, as well as getting them in an exercise protocol to where they can minimize their stress. Medical weight loss is something that's very special to me. I've practiced for many years doing eating disorders, treating obese patients. So I like to look at the patient in a different way. I like to teach them the right foods, how to eat correctly, and how to change their lifestyle. Every patient is different, and there are different reasons why patients do not lose the weight that they should. So we look at everything. We look at their nutritional status, we look at their lab work, we look at to see what it is that's preventing that patient from getting healthy and losing the weight. Not because they're not only going to look better and feel better, but also because they're going to be healthier and going to prevent diseases like diabetes and high blood pressure. If you'd like to know more about my practice and what I do, you can go to www.smartbodymd.com, or you can give us a call at 305-865-1991. Thank you.
The nation got a report card on obesity today, and the country flunked. Despite all attempts to attack the problem, a new survey shows the adult obesity rate increased in 23 states last year, and no state showed a decline. Here's Dan Harris.
The battle against obesity has been going on for years, with officials doing things like taxing sugary sodas, putting healthier foods in schools, and requiring longer, tougher gym classes. But still, Americans keep getting fatter. Today's study says the fattest state is Mississippi, where nearly a third of all adults are obese. The slimmest state is Colorado, but even there, 19% of the adults are obese. Childhood obesity rates have tripled since 1980. Again, it's worst in Mississippi, where 44.4% of children between 10 and 17 are either obese or overweight. This trend may only be exacerbated by the recession as the price of healthy foods rises, and so do rates of depression and stress, which are often linked to obesity. This crisis is sure to weigh all of us down eventually because obese people require more expensive health care, as President Obama noted today at a healthcare forum.
If we can help somebody control obesity, they are less likely to get diabetes. And if they are less likely to get diabetes, that means that we are going to be saving a whole lot of money in hospital costs.
The authors of today's report say the government needs to take rapid and dramatic steps, perhaps regulating food advertising to children, as has been done in some countries in Europe.
This just has to stop if we're going to have any hope of dealing with the obesity problem.
The study's authors also say the government needs to start thinking out of the box. Things as simple as requiring new communities to have good sidewalks for people to run and walk on could help, they say.
Sometimes it can mean keeping school playgrounds open at night. Sometimes it means providing the seed money to open a grocery store in a neighborhood.
Health experts have been calling for big changes for years, and to be honest, not much has happened. But the people I spoke to today say they are more optimistic about seeing real changes now because the nation is having this major debate over health care reform and because these obesity numbers are getting harder and harder to ignore.
This morning in Health Watch, 8 Steps to Wellness. Breakthrough is the latest book by actress and author Suzanne Somers. And Suzanne Somers is with us live in the studio this morning. Good morning.
Good morning.
So great to see you again.
Thanks, you too.
I always ask you the same first question.
Okay.
Because, you know, there are doctors and there are experts and there are people that say the last person you should take health advice from is Suzanne Somers.
Or Chrissy Snow. I was interviewing a brain scientist, and I had that flash. I thought, this is so funny. I used to be Chrissy Snow, and I'm interviewing a brain scientist. But that's the reality of my life now.
Right. You have gone through cancer, you've gone through significant life trials, and the biggest takeaway for you from all of that is what?
Lessons. You know, we learn from our lessons, and also, you know, growing up a child of an alcoholic too, which I've written a lot of books about, that you can, you know, when things happen to you, you can choose either to be a victim, why me, poor me, why do bad things happen to me, or the other way is, all right, I've been dealt this blow. How can I learn from this? How can I grow spiritually and emotionally? And that's usually where I go.
Take charge.
Yeah.
Take charge.
And then I learned something from it.
All right, I'm going to go through these 8 steps.
Okay.
Some of which I don't understand at all.
Okay, good.
And you have to help me out.
There's
You say
Dr. Summers.
get bioidentical hormone replacement.
Oh gosh, do you want to know about this? And I've got all the studies to back it up in the back. Harvard just came out with a report that says, hey, testosterone does not give you prostate cancer. You can take testosterone if you have prostate cancer, if it's not active. And the big one is men with the highest levels of testosterone live the longest and live the healthiest. So you put back what you lose in the aging process, which is what I've been doing for 13 years.
Okay, avoid chemicals and detoxify your body.
Well, I mean, it's the chemicals. Chemicals in diet sodas. One diet soda so overstimulates the neurons of the brain, it literally excites them to death in 6 to 8 hours. That's one diet soda.
Is that what happens to me?
Yes. That's
kind of in the middle of the
afternoon. Look at what happened to your hair. All that diet soda. No, really, chemicals, if you wonder why there's such an epidemic of brain tumors, pancreatic cancer, cancer everywhere, people are sick, people are not well, it's the chemicals. It's the greatest environmental assault in the history of mankind right now. We
may be offending a sponsor, so be careful. All right.
Oh.
Just making a joke. Just making a joke.
Right.
Take nutrition seriously. You've done that all your life. I'm going to jump ahead.
Eat real food. Just eat real food. If you can pick it, pluck it, milk it, or shoot it, you can eat it. The shoot, not moose.
Avoid pharmaceuticals unless absolutely necessary.
Yeah, people are overtaking pharmaceuticals. They're getting wacky. I mean, when did old people have to have a big tackle box full of pills and then you hire somebody to keep them straight? And if you notice the template of today's medicine, it's overdrug, 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 and then they end up in a nursing home.
The goal of my life is I want to be the oldest guy on the block who has to take a pill.
Okay, and you're going to have to live near me.
Okay,
all right, because we'll be the last
All right,
two there.
supplement your diet with
the big 3. I asked all the doctors. I take a lot of vitamins and supplements, but the big 3: fish oil. Fish oil protects you from cancer, protects your heart. Antioxidants eat up the free radicals from all the chemicals, and CoQ10.
Well, I don't know what that is.
That's for your heart. For your heart.
And exercise regularly, of course, and get proper sleep.
Yeah, and nobody's sleeping. Young people aren't sleeping. Older people take melatonin, natural over-the-counter hormone. And if your adrenals have been burnt out from overwork, which you probably have in your life, you can lower your cortisol by taking bioidentical cortisol replacement and feel really great, and you'll sleep. See, it worked. It worked.
It worked. I feel so much better.
I know. See, stick with me.
And always whenever I see you. Great
Thank
to see
you. Thank you. You too.
You bet. Suzanne Somers. To read an excerpt of Breakthrough, visit our website. That's earlyshow.cbsnews.com.
South Florida today on NBC6 HD.
Who doesn't want to live a healthier lifestyle and be more active? Smart Body MD is a wellness center that specializes in anti-aging medicine and weight loss treatment. Here to go more in depth on what they have to offer is Dr. Patricia Ares-Romero. Welcome, and this topic, absolutely fascinating. And we were just saying we could probably talk about this for like 15 minutes because there's so many angles. But, you know, my first question for you is exactly what does the center offer? Because it kind of appeals to all sorts of people.
Absolutely. Our patients are mainly proactive. And what we do is we have a comprehensive approach to health and wellness. So what we do is we go ahead and we look at your hormone levels and we see how it is that we can make them better. For instance, women start losing progesterone and become depleted as early as 30.
And what does that do? Does that
well,
like
the symptoms,
mess with your emotions?
Oh, absolutely.
Body?
Irritability, mood swings, insomnia, so you have difficulty sleeping.
Man.
Yeah, and even your PMS can get worse, as well as your flow of your blood flow could get worse during your period or your menses. So, and in men, for instance, testosterone, that's one of the big sex hormones with men. Loss of libido, poor energy, muscle weakness, more fat content in their body. So we look at these hormones to see how we can better help the patient.
And all of those things can be combated just by kind of adjusting
them and bringing them back to physiological levels. Absolutely. We also look at the metabolic hormones. We talked about sex, but metabolic hormones such as insulin, cortisol. We look at the growth factors, thyroid, which is so big. You know, if you have a deficiency in thyroid, fatigue, weight gain, you feel weak, kind of mimic a little bit the depression symptoms as well.
Interesting. So are these things that oftentimes a general practitioner or your regular doctor will not necessarily look at?
Right. I mean, some doctors do. We like to concentrate on it, as well as your nutrition. Nutrition is so important. You know, our mothers and grandmothers, we were talking about that earlier.
Oh, no.
We are what we eat.
I eat a lot of chocolate.
So, yeah. And, you know, and the nutritional, the American Nutritional Council has said that actually our nutrition in our food is 4 times less than it was 10 years ago. So if you eat 1 apple, you really need to eat 4 in order to have the nutrition we had 10 years ago.
I have never heard that.
So it's real scary. So the nice thing we do at Smart Body is that we have this functional test, and it's a blood test. We draw your blood, and we can actually tell you exactly what you're missing. The vitamin, the mineral, the essential trace mineral, whatever it is. And then scientifically, we can give you a recommendation. And we even take it a step further. What we can do is we can get you customized vitamins. So the guesswork is all gone.
See, I was wondering, because I was reading on your website that all of these improvements, you know, less body fat, like increased energy, all these things that you can combat, you know, without surgery. And this is so interesting. So it's all diet.
It's diet, it's hormone balance, is making sure that you have all the factors you need in order for your hormones to work. We look at toxicities. The United States.
Yes, what is this being toxic?
Well, we have a lot of toxins. We look at lead, we look at the heavy metals. But what happens is that, you know, we're exposed to more toxins than most of the third world countries. So these lie in our tissue, in our liver, in our bowels. So we have to detox our bodies in order for all our hormones to work correctly.
Okay, now is this something too that people, like, over time, like, you need to make adjustments for people oftentimes?
Absolutely, yeah. We would first start seeing patients 4 weeks, then we go ahead and adjust them every 4 weeks, then we go on to, you know, every 3 months or 6 months, depending on how they are.
Oh my gosh, all right. So if you want less body fat, you want more energy, better libido, all of those things, it looks like they can all be addressed through hormone therapy. Thank you so much for being here. You can visit Dr. Ares-Romero at Smart Body MD, located at 1111 Kane Concourse, Suite 607 in Bay Harbor Island, or call her at 305-865-1991 for more information. Visit smartbodymd.com. Looks like Natalie is coming up next.